They laughed at him before they ever learned his name. On his first week at St. Augustine Medical Center in northern Italy, the nurses whispered that he was just another caregiver. The junior doctors barely looked up when he entered the ward. And one surgeon, half joking, half dismissive, asked if he was there to clean the room or bring food. His name was Miguel Alvarez. He was Filipino, and he was assigned to the most difficult patient on the floor, room 712. The patient was Professor Carlo Di Luca, a 67-year-old cardiovascular researcher whose name appeared in medical journals across Europe. Brilliant, demanding, and now dying, Carlo had survived 2 surgeries, multiple complications, and an aggressive infection that no one could quite explain. Every test came back inconclusive. Every specialist had a different theory. But the one thing everyone agreed on was this: if Professor Di Luca crashed again, there would be no third rescue. Miguel knew none of that when he first walked into the room. What he saw was a man who couldn't sleep, couldn't eat, and didn't trust anyone anymore. Carlo didn't look at him when Miguel introduced himself. "I don't need a babysitter," Carlo said flatly. "I need doctors." Miguel nodded. "Yes, sir," that was all. No argument, no defensiveness, just calm acceptance. That alone irritated Carlo. Over the next few days, Miguel did what caregivers do. He adjusted pillows, monitored vitals, helped with hygiene, made sure medications were taken on time. Quiet work, invisible work. But Miguel also did things no one noticed at first. He watched how Carlo breathed when he was asleep. He noticed how his skin temperature changed at certain hours. He paid attention to what Carlo refused to eat, not just what he consumed. He observed how Carlo's hands trembled slightly whenever certain alarms sounded in the hallway. Miguel didn't write any of this down. He didn't need to. Back home in the Philippines, Miguel had grown up watching his mother care for patients in a provincial hospital where machines were scarce and intuition mattered. She used to tell him something he never forgot. "Listen with your eyes. Patients speak even when they're silent." At St. Augustine, no one was listening that way. The hospital ran on protocols, charts, numbers, alerts, algorithms, and Carlo Di Luca was becoming a problem those systems couldn't solve. His infection markers fluctuated without pattern. His heart rate dipped unpredictably at night. His oxygen levels sometimes dropped for no apparent reason. The doctors adjusted medications, increased dosages, changed combinations. Nothing stabilized him. During morning rounds, Miguel stood quietly against the wall while a group of specialists debated Carlo's case like a puzzle that refused to fit. One cardiologist sighed, "We're treating symptoms, not causes." Another said, "His body is simply failing." A third muttered, "At his age, sometimes there's nothing more to do." Miguel kept his eyes down. Caregivers weren't expected to speak in those meetings. But that afternoon, something small happened. Carlo asked Miguel a question. "Why do you always open the window at exactly 4?" Miguel paused. "Because your breathing changes around that time." Carlo frowned. "What do you mean?" Miguel hesitated, then spoke carefully. "When the air gets stale, your chest tightens. You don't notice it, but your body does." Carlo stared at him. "That's ridiculous." Miguel nodded again. "Maybe, but that night, Carlo slept better than he had in weeks. It was the first crack. Over the next days, Carlo began watching Miguel the way Miguel had been watching him. He noticed that Miguel never rushed, that he adjusted the bed before Carlo asked, that he brought water before Carlo realized he was thirsty, and more strangely, Miguel sometimes anticipated discomfort before it showed up on the monitors. Once Miguel asked for a nurse to recheck Carlo's vitals 10 minutes before an alarm would have gone off. The nurse rolled her eyes but did it anyway. The readings were already shifting. Word spread quietly. "Lucky guess," someone said, but Miguel didn't guess. He felt patterns. Then came the night everything went wrong. It was just past 2 a.m. When Miguel noticed something off, Carlo was asleep, but his breathing was wrong, not labored, not shallow, just uneven in a way Miguel had seen before years ago. Back home with a fisherman who later went into cardiac shock, Miguel checked the monitor. Everything looked normal, heart rate acceptable, oxygen stable, blood pressure within range. The system said everything was fine. Miguel's instinct said the opposite. He touched Carlo's wrist. The pulse was subtle but inconsistent. Miguel pressed the call button. A nurse answered. Irritated, "What is it? Please check in now," Miguel said quietly. The nurse glanced at the monitor. "There's no alarm, please," Miguel repeated. She sighed and said she'd come by after finishing another task. Miguel didn't wait. He pressed the emergency call. That brought people running. "What's the problem?" A resident snapped. Miguel pointed. "Something is wrong. He's crashing." The resident checked the monitor. "Vitals are stable." Miguel shook his head. "Not for long." Seconds later, Carlo gasped. Then his heart rate dropped hard. The room exploded into motion. Alarms blared. Doctors rushed in. Orders were shouted. Medications were pushed. For 10 minutes, they fought to bring Carlo back. They succeeded, but barely. When it was over, the senior cardiologist turned to Miguel. "What made you call it?" he asked sharply. Miguel swallowed. His breathing and his pulse. The cardiologist frowned. "That's not a diagnostic answer." Miguel didn't respond. But something changed after that night. The doctors started watching Miguel. Not openly, quietly. They noticed how often he was right. And then came the case that would change everything. 2 weeks later, Carlo's condition plateaued but didn't improve. The infection markers remained stubborn. His strength faded. His appetite vanished. One morning, a multidisciplinary team gathered and reached a conclusion. "We should prepare the family," the lead physician said. "There's nothing more we can do." Carlo overheard. That afternoon, he didn't say a word. Miguel noticed something else. Carlo stopped fighting. He didn't ask questions, didn't complain, didn't even argue. That scared Miguel more than any alarm. In Filipino culture, caregivers are taught that when a patient gives up internally, the body soon follows. Miguel sat beside him and spoke softly. "You are tired," Miguel said. Carlo nodded faintly. "They think I'm finished." Miguel hesitated. He had never challenged doctors directly before. But something inside him refused to stay silent. "May I tell you something?" Miguel asked. Carlo looked at him. "My people," Miguel said slowly, "believe the body listens to how it is treated, not just medicine, intention." Carlo gave a weak smile. "You think kindness will cure me?" Miguel shook his head. "No, but ignoring what you feel will kill you." That night, Miguel did something no protocol allowed. He stayed longer. He adjusted Carlo's position multiple times, not for comfort, but for breathing mechanics he recognized instinctively. He noticed that Carlo's oxygen dipped whenever he lay completely flat. So Miguel angled the bed slightly, just enough. He observed how Carlo reacted to certain antibiotics, subtle changes in temperature, skin tone, restlessness, and then Miguel made a connection no one else had. The infection wasn't random. It spiked after medication cycles. Miguel brought this up carefully the next morning. The attending physician frowned. "We've ruled out allergic reactions." Miguel nodded. "Not allergy. Stress response." The room went quiet. "A caregiver is diagnosing stress," someone scoffed. Miguel didn't argue. He simply described what he'd seen: patterns over days, not numbers over minutes. Reluctantly, a junior doctor ran additional tests. The results were unexpected. Carlo's body was reacting not to the infection but to the treatment itself. The aggressive protocol was overwhelming his already fragile system. They adjusted the plan, reduced intensity, changed timing, altered positioning. Within 48 hours, Carlo's markers began to drop. Within a week, he stabilized. The laughter stopped. Months later, Carlo walked out of the hospital. At a staff meeting, the chief physician addressed the team. We talk about evidence-based medicine, he said, but we forget that evidence includes observation, and observation requires humility. He looked at Miguel. Miguel didn't smile. He simply nodded. Carlo later told a journalist something that spread quietly across medical circles. They saved me with machines, Carlo said, but he saved me by paying attention. Miguel returned to work the next day. Same uniform, same role, same quiet presence, but no one laughed anymore, because they had learned something uncomfortable, that sometimes the most advanced knowledge in the room doesn't come from textbooks, titles, or machines. Sometimes it comes from a place forged by necessity, from cultures where care wasn't a profession but survival, and from people the world taught itself to overlook. They laughed at the Filipino caregiver until he saved the patient no one else could, and the lesson stayed long after the laughter was gone.